In this video, we will discuss all the facial bones of the skull in ox. Nasal bones, paired, elongated and curved plates placed anterior to the frontal bones. You can see, so these are the nasal bones. You can see nasal bones, so they are placed anterior to the frontal bones. They form the major part of the roof of the nasal cavity. So you can see nasal bones. If you see the dorsal or facial surface, this is the dorsal or facial surface, okay, convex. Ventral means below this, the nasal surface, that is concave. Lateral border remains free. You can see, this is the nasal bone, this is the lateral border, remains free. Helps form the nasomaxillary notch along with the premaxilla. So this is the premaxilla, this is the nasal, this is the pre-lateral border. Okay, so you can see a notch here. Okay, this notch is called nasomaxillary notch. Nasomaxillary notch. Then caudal or posterior. Ends of both the nasal bones unite to form a median projection. You can see the caudal or the posterior, okay, ends of both the nasal bones unite to form a median projection. So you can see this is a median projection, okay, median projection, which fits into the notch created by the rostral ends of the frontal bone. You can see these two are the frontal bone. It is their rostral ends, okay. So together what? So together they form a notch into which the median projection formed by both the nasal bone, it fits. Then premaxilla or incisive bone. Okay, you can see this is the premaxilla bone. Okay, premaxilla forms the front part of the upper jaw. It consists of a body and two processes: nasal process, palatine process. Body of the premaxilla. You can see. So this part is called body of the premaxilla. Okay. Lateral or outer surface related to the upper lip. Okay, you can see. So this is the lateral or outer surface. It is related to the upper lip. Buccal or inner surface lies adjacent to the dental pad. That means below this. Okay, below this you will find the buccal or inner surface that is present close to the dental pad. This point is very important. Medial border means these two are the medial border of both the side. Okay, concave forms the incisive fissure along with the opposite premaxilla. You can see. So medial border of each side. Okay, together they form a fissure. So this fissure is called incisive fissure. Very, very important. Nasal process. Okay, project upward from the body. Okay, so this is the nasal process of the premaxilla. Okay, they project upward from the body, contributes to the lateral wall of the nasal cavity. Both facial and nasal surfaces are smooth. Okay, so you can see this is the nasal process, this is the facial surface, and inside this side you will find the nasal surface. So facial surface outer, inside you will find the nasal surface. Both surfaces are smooth. Then palatine process. Okay, so you can see this is the palatine process. Okay, so they are smaller and thinner than the nasal process here. So this is the nasal process, this is the palatine process. Thinner than the nasal process, forms the rostral part of the hard palate. Okay, so they form the rostral part of the hard palate. Then the palatine process, its nasal surfaces slopes medially, forming a groove. Okay, so you can see this is the nasal surface of the palatine process. Okay, so they form a groove with the opposite side for the vomer and nasal septum. So now you can see a groove is created here. Okay, the groove is created here. So here you will find it gives space or accommodates the vomer and the nasal septum. Okay, laterally the palatine process separated from the nasal process and the maxilla by palatine fissure. Here, so this is the maxilla bone. and this is the nasal process of the premaxilla, and this is the palatine process. In between then one gap you will find this oval shaped opening. This is called palatine fissure. Then maxilla, largest bone of the upper jaw. Okay, you can see. So this is the maxilla bone, largest bone of the upper jaw. Bears the upper cheek teeth. You can find these are the cheek teeth. Okay, located on the lateral side of the face. It is composed of body and two processes. We'll discuss palatine and zygomatic. Body of the maxilla is external or facial surface. Okay, so this one you can see. So this whole surface. Okay, so this whole surface is the your external or facial surface of the maxilla. Okay, it is convex in shape at the level of the first cheek tooth. Okay, means at this level. This is the first cheek tooth. At this level, it will bear a what? Foramen. This is the infraorbital foramen you can find. At the level of first cheek tooth, infraorbital foramen, opening of the infraorbital canal. So you can see this is the first cheek tooth. At this level here you will find infraorbital foramen. It is the opening of the infraorbital canal. It transmits infraorbital artery and maxillary nerve. At the level of third cheek tooth, you will find facial tuberosity. Okay, 1, 2, 3. So at this level, you will find facial tuberosity. You will find it extends into facial crest. You can find this one. This is the facial crest. Okay, so this is infraorbital foramen, facial tuberosity, and facial crest. Facial crest. Internal or nasal surface of the body of the maxilla. So what you will find? It forms part of the lateral wall of the nasal cavity. Okay. Midways bears ventral turbinate crest. Okay, you can see somewhere at the midway you will find a ventral turbinate crest. You will find here it is the ventral turbinate crest. It supports the ventral turbinate bones. Below that you will find the lacrimal group. Okay, so below this you will find the lacrimal group. Okay, or nasolacrimal duct. Dorsal border of the body of the maxilla. Okay, since this is the dorsal border, you can see this irregular scaly articulates with the premaxilla. Okay, this is the dorsal border. You can see the dorsal border. It articulates with the premaxilla bone. Okay, mainly the nasal process of premaxilla, and it articulates with the at this point nasal bone you will find here it is removed. Okay, a lacrimal bone you can find. This is the lacrimal bone. Okay, and this is the malar bone. So this is the dorsal border articulates with the various bones. Then ventral border means this is the ventral border you can see. So this is the ventral border of the body of the maxilla. So posteriorly you will find 6 alveoli for the cheek teeth. Okay, so 1, 2, 3, 4, 5, 6. Okay, you will find 6 number of alveoli, sockets for your cheek teeth. Anterior lid is free. So anterior tip joins with the premaxilla. So this is the anterior tip, it is free. It joins with the premaxilla. Posterior end. Okay, so this is the posterior end of the your maxilla. Just behind the alveolus. You see, this is the last alveolus is somewhat here. What you will find? You will find alveolar tuberosity you will find. Okay, you can find. So just behind the last alveolus. So this is the last alveolar socket. So just behind this you will find a tuberosity that is called alveolar tuberosity. Okay. Then you will also find maxillary tuberosity at the extreme back. So here you will find, so this is the maxillary tuberosity you can find. Okay. It lodges the maxillary sinus, means inside the maxillary tuberosity, you will find the maxillary sinus. And medial to this maxillary tuberosity, what you will find? You will find maxillary hiatus, where you will find important structures. So now you can see, so this is the maxillary tuberosity. Okay. So medial to this here you will find a what? Maxillary hiatus you will find. Okay. This is the maxillary hiatus. Okay. And here we will find several structures, important foramens like this one. Okay. So this foramen is the sphenopalatine foramen. Okay. And just here you will find another foramen, that is the maxillary foramen. Here you will find, and here also you will find the posterior palatine foramen. So these are the important structures here in the maxillary hiatus. Okay, this is the spinopalatine foramen, and just here you will find another foramen. Here you will find, that is the maxillary foramen, and this is the maxillary hiatus, and this one is the your posterior palatine foramen. Then processes of maxilla. First, zygomatic process means this one. This is the zygomatic process of the maxilla. Small projection from the posterior part overlapped by the malar bone. So just above this you will find the malar bone. Okay, so this is the zygomatic process of the your maxilla. Then palatine process. Okay, so you can see, so this whole structure is the palatine process of the maxilla. It contributes major part of the hard palate. Its oral surface shows various structures. So this is the oral surface, okay, of the palatine process of the maxilla bone. What you will find? You will find palatine groove. You will find this is the palatine groove. Okay, it is for greater palatine artery and the nerve. But inside this internally you will find palatine sinus. You will find. Okay. Then palatine bone. Okay. So this is the palatine bone. Paired bone located on the either side of the posterior nares. You can see. So this is one posterior nare. This is one posterior nare. On the either side of the posterior nare you will find palatine bones. Each consists of a horizontal transverse part and vertical perpendicular part. Horizontal part means this part. So this is the horizontal part. Forms the caudal 1/4 of the hard palate, bony palate. Its anterior border joins with the palatine process of the maxilla. So you can see this is the anterior border. Okay, and this is the anterior border. Okay, it joins with the palatine process of the maxilla. Then posterior border free. This is somewhat free. Posterior border free. Okay, posterior border free. Gives attachment to the aponeurosis of the soft palate. Medial edge unites with the opposite palatine bone at the median palatine suture. You can find this is the median palatine suture. Palatine surface or oral surface, the horizontal part, what you will find? You will find anterior palatine foramen here near the mid region. So you can see. So you can see here. So this foramen is the anterior palatine foramen. Anterior palatine foramen. Okay. So you can find palatine groups, very faint group continues forward from the foramen. You can find a groove here. You can clearly see a groove. So this groove is the your palatine group you can find. Okay. You see the foramen is the anterior palatine foramen and the groove is the very faint groove is the palatine groove. Then in the horizontal part you will also find the palatine canal. You will find this entirely housed in the palatine groove. Okay, you can find this is the your canal, palatine canal, opens caudally at the posterior palatine foramen within the maxillary hiatus. Okay, so this is the canal, the palatine canal. Posteriorly, it opens at the posterior palatine foramen. Okay, so this is the posterior palatine foramen and this is the anterior palatine foramen. Again repeating, anterior palatine foramen, and here you will find the posterior palatine foramen. Then come to the perpendicular part, palatine bone. Perpendicular or vertical part of the palatine bone. It forms the posterior part of the lateral wall of the nasal cavity. Articulation. Medially, this perpendicular part articulated with the pterygoid bone. Okay. So this is the perpendicular part of the palatine bone. So medially here you can see it articulates with the pterygoid bone. Okay. Laterally it articulates with the subsphenoidal process or pterygoid process of the postsphenoid bone. So you can see this one. So this one is the pterygoid process or subsphenoidal process of the your sphenoid bone. Then what you will find? The notable features here you can find. Already we have discussed. So this is the spinopalatine foramen you can find. Okay. Along the upper margin, you will find a notch. Okay. So this is the upper margin of the perpendicular part of the palatine bone. It forms a notch that contributes to the spinopalatine foramen. Actually, this foramen is completed by articulation with the ethmoid and the presphenoid. Okay, so here you will find the ethmoid and the presphenoid, and it all together they form this spinopalatine foramen. Then pterygoid bone. Okay, so this is the pterygoid bone. Means just above the perpendicular part of the palatine bone, you will find the pterygoid bone. So thin flat plates of bones located on the either side of the posterior nares. Again, this is the posterior nares. Okay, on the either side you will find the pterygoid bones present over the vertical part of the palatine bone. So already we have discussed just. So this is the vertical part, perpendicular part of the palatine bone. Above this you will find the pterygoid bone. Okay, if you see the medial surface, okay, this is the medial surface. This is the medial surface. Contributes to the lateral wall of the posterior nares. Okay, the lateral surface articulates with the perpendicular part of the palatine. Okay, means this is the lateral aspect. Okay, this is the pterygoid bone. Okay, on that side means lateral side, means this side you can see. Okay, so on the lateral side it articulates with the perpendicular part of the palatine. Means in this side you will find this pterygoid bone. On the lateral aspect you will find this perpendicular part of the palatine bone. Okay, and you will also find subsphenoidal process of the sphenoid. So you can also find. So laterally, so this is the pterygoid bone. On the lateral aspect you will find articulation with the perpendicular part of the palatine and the pterygoid process of the sphenoid or subsphenoidal process of the sphenoid. Upper end forms the pterygoid or Vidian canal along with the sphenoid bone. You can find here. Okay, so you can find here canal-like structure. Okay, so this canal is called your Vidian canal. Okay, lower end is free and projects as a curved hook-like process called hamulus pterygoideus or hamulus. So this is the lower end of the pterygoid bone. It is free and it is in the form of a curved hook-like structure. Okay, here it is not there. I have made it by drawing, but actually in this part you will find a curved hook-like structure like this. It is the drawing actually. Actually it is actually detached from this a part, but you will find a curved hook-like structure like this. This is called hamulus or hamulus pterygoideus, around which the tendon of tensor veli palatini muscle is reflected. Lacrimal bone. Okay, so you can see this is the lacrimal bone. Paired bone located at the front part of the orbit. Okay, so this is the eye orbit. Okay, at the front you will find the bone on the either side. Extend forward onto the face, contributing to both orbital and facial structures. Okay, if you see the lateral surface. Okay, so this is the lateral surface of the your lacrimal bone, divided into two regions by orbitofacial crest. So you can see this one. So this crest is or demarcation is called the orbitofacial crest. It divides the lateral surface, okay, into two parts, facial surface and orbital surface. So this is the facial surface of the lacrimal bone, orbital surface of the lacrimal bone, and this is the orbitofacial crest. So first we discuss the orbital surface, means this surface. This is the orbital surface, forms the anterior part of the medial wall of the orbit. Just behind the orbitofacial crest you will find lacrimal fossa. You see, so this is the orbitofacial crest. So here you will find a depression here. So this is a depression. The depression is called lacrimal fossa, which contains the opening of the lacrimal canal. So this is the opening of the lacrimal canal and the fossa is the lacrimal fossa. And here what you will find, here you will find a sac-like structure also, that is called lacrimal sac. floor of the orbital surface has a prominent lacrimal bulla. Okay, so you can see, if you see the floor, this is the orbital surface of the lacrimal bone. So at this floor, you will find a complete swelling bone-like structure here at this point. Or some part is actually removed or detached. A portion is shown here. So this structure, it is called lacrimal bulla. Floor of the orbit has a prominent lacrimal bulla. Inward air-filled projection. Maxillary sinus extends into this bulla. Okay, so this structure is your lacrimal bulla. Then facial part. This is the facial part of the lacrimal bone. Extensive area on the face. The nasal internal surface of this part means inside that. Okay, on the medial aspect you will find osseous nasolacrimal canal. Malar or zygomatic bone means this one. Irregularly triangular bone located between the lacrimal and the maxilla. Just we discussed. This is the maxilla bone. Okay, and this is the lacrimal bone. Between them you will find the malar bone or zygomatic bone. Contributes to the zygomatic arch and orbit we will discuss. Surfaces of malar bone. The malar bone has three distinct surfaces. First, lateral or facial surface. Okay, so you can see this one. This is the lateral or facial surface. It is broad and convex. Here is the facial crest. Okay, you can see. So this is the facial crest. Okay, facial crest. Okay, running just below the orbital rim. Okay, so this is the orbit. So this is the rim of the orbit. Okay, so just below that you will find this facial crest. So this surface is the facial or lateral surface of the malar bone. Next is the orbital surface, means this surface. You can see this surface. So this is the orbital surface. Okay, narrow, forms part of the posterior wall, part of the floor, anterior wall of the orbit. Nasal surface means just behind that, medially. Okay, it is free surface, contributes to the maxillary sinus. That we cannot see from this view. Okay, processes, very important. First, zygomatic process. Okay, so you can see zygomatic process. Okay, so posterior part of the bone divides into a frontal process and temporal process we will discuss. So this is the frontal process and this is the temporal process we will discuss. So first, frontal process. We can see. So this is the frontal process or frontal part of the zygomatic process. You see the total process is the zygomatic process. This is the frontal part or frontal process. Okay. Articulates with the supraorbital process of the frontal bone. Okay, so this one is the supraorbital process of the frontal bone. So together they articulates here. Okay. Helps form the posterior margin of the orbit. Then temporal process. This you can see this one. So this is the temporal process of the malar bone. Okay. And this one is the zygomatic process of the temporal bone. So zygomatic arch is formed by temporal process of the malar bone or zygomatic bone and zygomatic process of the temporal bone. So together they form the zygomatic arch. Turbinate bones, also called nasal, conchae, delicate scroll-like bones. So you can see the delicate scroll-like bones. Two pairs, dorsal and ventral, present on either side of nasal cavity. So this is the dorsal turbinate. This is the ventral turbinate. Attached to the lateral walls of the nasal cavity. This is the dorsal turbinate bone. This is the ventral turbinate bone. This is the ethmoturbinate bone. Okay. And this is the middle turbinate bone. Vomer, unpaired bone. So vomer is the unpaired bone. You can see this is the vomer. U or V-shaped, forms the ventral part of the nasal septum. So here actually you will find the nasal septum. Here you will find. Okay. The vomer forms the ventral part of the nasal septum. Consists of thin lamina bent to form a groove-like structure. Okay. So you can see. So a groove here you will find. Okay. So this groove accommodates perpendicular plate of the ethmoid and septal cartilage.